In this video, I'll be talking about Ataxia Telangiectasia. Finally. But for the sake of this video, I'll be referring to it as AT. So first, let's start off with some of these symptoms and the occurrence of AT. So some of these symptoms include difficulty coordinating movements. So AT can affect various body systems, such as the nervous system and immune system, which can ultimately lead to difficulty walking, balance, and hand coordination. And AT often occurs at the beginning of early childhood, approximately before the ages of 5. So AT is inherited in an autosomal recessive pattern. So there's no clear distinctive gender pattern. It's not favored towards a specific gender, in other words. AT is a genetic mutation. So anyone can inherit AT if both parents carry a copy of the AT gene mutation. AG gene mutation is also referred to as a faulty ATM gene, which often occurs when one of the two ATM genes a person inherits is not functioning properly. So both parents can carry one copy of the gene, but will show no symptoms of the condition because they need two copies of the gene to receive an AT diagnosis. In other words, a good analogy to refer to this is a cut up picture divided into halves. You can't make out the picture if you don't have the two halves. So when you have the two halves, now you can make out the picture. Hence, why if you have one copy of the gene, you'll show no symptoms. But when you have two copies from both of your parents, you can become diagnosed with AT. So let's take a look at this from a pedigree perspective. So it is understood that AT is inherited as an autosomal recessive pattern, as it can be seen that it is a genetic condition that occurs when the child inherits one mutated copy of a gene from each parent. So, as previously mentioned, the parents don't usually have the condition because the parents are called carriers. So they carry one copy of the mutated gene and they can pass it to their children. In addition, we don't see no distinct gender pattern. So it does not affect the males more than the females or vice versa, as also mentioned in the other slide. So AT is not dominant for it skipped a generation. In other words, we see that because AT has skipped a generation, it shows no signs of being a dominant gene. As some can be carriers, but they're not necessarily affected or diagnosed by AT. Research. So, what type of research is being conducted by scientists for AT? Two of the main ones that include blood tests and magnetic resonance imaging, also known as MRI. So, why blood tests, you may ask, is because blood tests help scientists identify treatable causes of AT. MRIs, on the other hand, demonstrate to scientists the brain and help determine the possible causes that lead to AT. In addition, MRI can sometimes demonstrate shrinkage of the cerebrium and other brain structures in people diagnosed with AT. Here's my works cited page. That concludes the end of this video. Just a short introductory course about AT, what it is, and yeah, make sure to subscribe if you enjoyed.